Hello everybody, I am Roberto Ferrari from the University of Ferrara, and I'm here to tell you that to have elevated blood pressure is bad. It damages the heart, the brain and the kidney. And the problem is that you do not feel the level of pressure in the pipes of your body. For this reason, hypertension or high blood pressure is considered the silent killer. This is because there is too much salt in your meal. So please, my message to you is please reduce the salt in your meal. Cook with less salt. Remember, this is an S.O.S. Step down with your salt. It's very important for your health. Of course, this can be done, and Dr. Jaykumar P will tell you how to do it.
Thank you, Dr. Robert Ferrari. I think it's important to create an awareness about salt intake in our hypertensive patient. I think we should always educate the patient regarding the harmful effects of high salt intake and the ways to limit the salt intake. For example, on average, Indian consumes almost 11 to 12 grams of salt per day, but the recommended salt intake according to WHO or World Health Organization are 5 to 6 grams per day. So there are a lot of ways to improve the blood pressure control non-medically with just following this step-down approach. What we understand by step-down approach is daily we can reduce the salt intake in each processed food. Whatever I recommend is just avoid adding excess salt over the salads, especially salads, avoid processed foods, and especially the fruit and other beverages which you are going to have, please try to have without any excess salt. And Indian spices contains lot of extra added salt. For example, pickles, peppers, jeera juice, and so many things are there where we can definitely reduce the salt intake by almost 75 to 80%. It doesn't mean that the person has to have less salt, but always it is better to avoid taking high salt intake. Lesser, from normal we go to lesser, and from lesser we go to least intake of salt. Thank you.